JGP team. And I do accept to be recorded. I just want to welcome everybody as you're jumping on. Jason is here also, who you've heard from a lot. And I want to welcome we have an advisory committee that guides all of our work, and we might see a handful of those people on the phone too. I see Donna Jackson, Holly, Bob Danewood, and others who are always helping to steer the work of EJGP. So I just want to thank them for that. Any new folks, would just love to see your hands, either your virtual hand thingy or raise your hand. Welcome to the new folks if this is your first time on a network call. Welcome, Mary Kate. I see.
The power of dedication, even.
Okay, so we're super excited today in particular to have Dr. Vann on our call today. But these calls that have been happening about every other month, we try to bring forth an issue that is front of mind to Pittsburghers. And so I just want to lead first with reminding us about EJGP's mission and vision, which is our mission is really to push for equitable and just policies and programs to achieve transformational, people-centered change in greater Pittsburgh. So that looks like having all kinds of people on these calls, lifting up the issues that are happening and hearing firsthand experience from residents. And so thank you guys for joining today. Our goals for today are really to focus on an introduction to the new director of the health department, and also introductory conversation about community health and what that's looking like right now. So we're going to hear from some leaders and organizations working with residents, and we're also going to hear from some speakers just having firsthand experience dealing with some of their challenges in this space. And hopefully you will know how to better connect to the issues. I know some of you are already, sounds like, going to health department meetings, but you'll have an opportunity to get better connected to doing something about having a healthier Pittsburgh. So with that, we're gonna have a panel discussion for a little bit under an hour. And then we are going to transition into smaller breakout rooms with each of the speakers so that you can have additional conversation. So last thing from me are just a couple of ground rules. While we've all come to love and appreciate Zoom, we just want to remind everybody to speak from your own experience. Be present with us if you can. That means, like, if you can put your phone away, email, close all your apps, just be present with us for 90 minutes and really, be with us in this space and listen to each other. So we would love to see you if you can be on camera. And let's try to not interrupt each other. I know most of these calls are fine for that, but just focus on one diva, one mic, as our colleague Celeste would say. So lastly, I have to read a little bit of language about these calls, and that's our disclaimer that the views expressed in presentations made at EJGP network meetings or other EJGP events are those of the individual speakers and not necessarily of EJGP, other organizations, groups, or individuals in the network, or our funders. Presentations at these events or the presence at other events does not constitute an endorsement of any speakers or organizations' views, ideas, and services. So these meetings are intended for education purposes and do not replace independent professional judgment. So now that I did my homework, I'm going to turn it over to Jason.
Right. Thank you, Yvette. Hold on. Can I spotlight myself? I don't know. Regardless. Okay, so thank you all for being here today. We're really excited to have you as guests and also to have our panel here with us today. So I want to just kind of set the stage for what we're going to be talking about today. So as you saw, what brought you all here is that we are going to be talking about public and community health. So to get things started, we wanted to talk a little bit about what ACHD does. What does the county health department do? And so from the website, ACHD's mission is to protect, promote, and preserve the health and well-being of more than 1.2 million people who call Allegheny County home. ACHD offers clinical services, including immunization, dentistry, and sexual health resources, as well as programs designed to promote a safer, healthier community for all by focusing on air quality, lead exposure, and other environmental factors that impact residents. And if you go to their website, you'll also see that their work also includes monitoring programs on food safety, plumbing, chronic disease prevention, as we all know, and infectious disease prevention, as we all really know. What are we talking about today in terms of health? So we're talking about this whole broad idea of community and public health. And we know that that's broad. And we think health is so important, public health and community health in particular, because they're connected to so many different parts of our lives. And our panel today is just going to talk about a few of them, and there are many, many more. But before we begin, it's really important for us to acknowledge that many of the public and community health challenges that we face today have grown out of our region's environmentally unjust history. Our history of industrial pollution, plus wealth inequality, plus racism through practices such as redlining, racial covenants, and discriminatory lending and investment have shaped the patterns of inequitable health outcomes that we still see today, right? So this is not a new thing. This is a history that we're trying to undo, and as we strive for health equity in Allegheny County. Recently, we know that there have been a lot of things that have come out about inequality. We've heard a lot over the last few years about Black maternal health, chronic diseases, violence, lead in the water, air quality, COVID. Lots of topics where health inequality is very, very present. We probably won't get all of these topics today, but we will hopefully touch on several of them. So with that, I'm going to pass it to Yvette to introduce our speakers, who we welcome, and we really look forward to having a constructive conversation today.
Okay. So I am going to start with Dr. Iulia Vann from our new director of the Allegheny County Health Department. And she started her role in August of this year. So very brand new and excited to have everybody hear from her. And previously she worked in North Carolina, where she's worked in the field of public health for 12 years, including as the recent director of Guilford County, where Greensboro is. Then we have Terri Shields, who's one of my Hazelwood heroes and one of the women I look up to very much. And she is the founder and executive director of JADA House International. Elder Terri Shields, she's passionate about individuals working in the space and is really serving multi-generational. She's doing much multi-generational work. So her work really spans across creating opportunities for young and old, and across education, healthcare, employment, and anything that people might need in Hazelwood. So, and then we have Tracey Joiner. She is the director of community health at, sorry, I'm like trying to read everybody's bios, at the Neighborhood Resilience Project. So welcome to Tracey. She's a certified community health network, and I love that her passion is noted as trauma-informed community development. So she is really focusing on empowering and supporting and healing vulnerable people. And then Qiyam, am I saying that right? Yes. Is the president of Valley Clean Air Now. He is an environmental justice organizer who's supporting grassroots work to improve air quality. His work is also informed by firsthand experience of, I think he's going to talk a little bit about this later, but dealing with the space in Pittsburgh. And then Kevin Quisenberry, he's the Litigation Director at Community Justice Project. So he's been there since 2003 and is working to protect the rights and interests of lower income Pennsylvanians on a variety of issues, but including policy, the rights of renters and homeowners, and protecting our civil rights. So we really wanted to get a diverse group of people that are working around community health. So I want to start with Dr. Vann and ask you, how you think of public health. What's your approach and your priorities as you know them so far?
Thank you so much, Yvette. And again, thank you so much for having me here today. It's such a pleasure to talk about the topic that I feel most passionate about, which is public health. I know that I've been here for almost 2 months now, but definitely time flies when you're having fun. So thank you so much for giving me this opportunity. And with all of the wonderful partners on the call today, I'm really excited for this conversation. So in my opinion, when approaching public health, it's really that my philosophy centers on creating an environment where health equity, community resilience, and proactive intervention guide all our work. And to get a little bit more deeper in that, specifically around health equity and justice, really reducing health disparities is at the core at what we do in public health, whether it's environmental hazards, access to health care, or disparities in disease outcomes. My aim is to identify and address these inequities with partners, with our teams, so that everyone, regardless of zip code, income, can really lead a healthy life. So how do we approach that, or how do I approach that, from a professional philosophy perspective? I really believe in meeting communities where they are, addressing barriers that prevent people from achieving that optimal health, which means focusing on social determinants of health, from economic stability to education, housing, access to nutrition, food. All of these areas are ensuring that all residents, especially the marginalized communities, have a fair opportunity to live the healthy lives that they deserve. Also, focusing on community-centered partnerships. I am very much leaning into the collaboration and the ability to really work together, building these resilient partnerships like the ones that I'm fostering today with Urban Kind, with EJGP, and everybody else on the call today. It really amplifies the community voices. It empowers our community members. It ensures that the public health strategies reflect the ones with lived experiences, that reflect the people that we serve. And that's critical. And in my opinion, because you were asking me, my philosophy, public health is not effective unless it's community driven. I prioritize collaboration with local organizations, community leaders, residents, community members, other officials in the areas that we're serving, to ensure that health initiatives are relevant and tailored to the community needs. I completely take the saying, doing things with the community and not to the community, just very seriously throughout my career. And that is the type of approach that I also bring to Allegheny County. I also believe that environmental health is a core element of public health, especially as climate change and pollution, and we're seeing the impacts of health outcomes because of these issues. I prioritize projects that are addressing air quality, water quality, lead exposure, climate resiliency, because investing in sustainable practices and environmental justice, we know that these are going to reduce the health risks related to pollution and prepare our communities to have a healthier, more resilient future. And then the last part that I think it's very important and I truly believe in is really transparency and inclusive communication. Again, in my opinion, public health can only thrive when we have open communication and transparency. I focus on making sure that our residents are informed. I listen to their concerns. I listen to their voices. I want to be able to provide them a space where their voices are heard, and that they are part of the decision-making process. So you will see that through my leadership in the health department, as well as maintaining that transparency, because it just builds trust. And right now, I think that more than anything, we need for our community to trust that public health is here to support them, to provide them with resources, and to encourage their active participation and making public health efforts more effective and inclusive. So just kind of overall, I think that these are the 4 areas that I wanted to bring to the table today as part of my philosophy and my approach to public health and what public health is for me.
Yes, and that's so great. Like I mean, I can say from our experience on preparing for this panel that you've been super open to hearing firsthand and from residents. So we're hopeful that, you know, these 4 pros on the ground and everybody else can help inform your work. So I'm going to lead with Terri, because we want to transition to like hearing what you guys are seeing on the ground. So based with your work, you know, JADA House or anything else you want to bring up is like, what are the core health related issues that you're seeing from residents?
Good afternoon, everyone. JADA House, we uplift and empower generations of people by building programs to strengthen our communities, right? So we do generational work. We work with our seniors, we work with our young folks, and we work with our grandparents because we have a kinship program. So we deal with nutrition, we deal with exercise, we deal with stress. I see Jermaine's on the phone, and she has been a part of our kinship program dealing with women's healthy environment. We also deal with partners such as our community university partners, which is Pitt and Duquesne. They help us with presentations on Alzheimer's, dementia. So it's more or less like a mental health type of mental health type of thing. And then we deal with the nutrition as well, because I feel like the community needs to know all the resources. And as me being an African American in the low income community, we need to be transparent. We need to give have those resources available. And that's why I'm in so many different cohorts and programs, trying to get those resources out to my community to help them live a more sustainable life. Because a lot of times caregivers, a lot of times children don't understand the different deterioration of their parents or their grandparents. So it is my job, while it is my job to bring that information to my community as best I can, as much as I can. And that's what JADA House is all about. And also, Ms. Vann, you brought up a very important part about being transparent. Transparent builds trust. It builds trust. So the resources need to be in every community, whether it's the upper class community or the lower class community. It needs to be in all communities, and they need to be aware of their resources. And that's what JADA House International job is to do, bring in resources.
And I would love to connect with you also offline so we can see how we can do that better. I know that we're doing a good job now, but I know that we can do it better.
Absolutely.
Thanks, Terri. And I want to shift slightly over to Tracey and the work you're doing with your health ambassadors. So what are they hearing? You know, what is the work that they're doing out and about in the neighborhood?
Thank you guys again. Thank you, Jason, and Urban Kind for allowing me in your space today. I really appreciate it. So basically what we're hearing is that there is mistrust with hospitals and organizations and government in the community. And our job, I guess, as ambassadors, as community health deputies, community health workers, like Ms. Shields said, we're trying to connect trying to connect the community to resources, and and looking at different communities, we're trying to address the social determinants of health in each of these communities and connect them to the resources that are available to them. My goal, one of my goals here is to reduce the death gap in these communities. We know, like, if you live in Squirrel Hill, the likelihood of you living longer is better than in some of these underserved communities. So not only connect them to resources, but developing programs that enrich their lives. We have partnered with the University of Pitt and their cardiology department for the Lifesavers initiative. It's a lifesaver program, which we are training people in the Hill District, and we would like to expand that into other communities, teaching everyday people life-saving techniques. That's CPR, stop the bleed, and things along that nature. But basically, what we're doing is, with the hard work that Mrs. Shields is doing and Urban Kind is doing, and a lot of other organizations, we're partnering with hospitals, community leaders, churches, and just trying to better serve our community, because we know when we work together, people get healthier, and that is our focus here at Neighborhood Resilience Project, empowering people to become productive members, first being healthy, and then becoming productive members in their own destiny. We have to join with these groups and really fight these disparities and connect people to resources. I think that's it. Sorry.
Oh, sorry, I muted myself for a second. Okay. I was going to say we're going to dig into it a little bit more, but Qiyam, I'm sure you guys are doing this type of work for various reasons, but Jason, I happen to know you have very personal reasons for it, and just wanted to see if you could share kind of like your personal experience with bad air and how that took you, to what you're working on now.
Yeah, absolutely. I appreciate it. Hello, everyone. My name is Qiyam Ansari. I am the president of Valley Clean Air Now. We are a small community-based organization based in Clairton. We work in the Mon Valley, primarily focusing on giving resources to community members. That's manifested itself through an air filter program of ours. We've been doing health research, trying to understand the full breadth of the problem that's, taking the lives of our community members. And then we're also, working on the advocacy side. So, educating community members and trying to connect them with the people like ACHD, the EPA, or whoever that has the power to actually, create some change in their lives. So for me personally, I, grew up with mild asthma and, I was a pretty healthy kid. I actually had a pretty bad asthma attack because I didn't have my inhaler during an inversion. Um, the air quality was bad, ended up sending me to a hospital, was in a coma for 2 weeks. I had to learn how to walk when I, came out again. Um, and essentially the doctor told me that, if you would like to live, you should leave Pittsburgh. And if the air quality is bad, you should not go outside. He said my normal asthma went from regular to life-threatening, which meant that they couldn't tell if I would survive my next asthma attack. So that really opened up my eyes to, environmental injustice and environmental justice. I started to connect some of these economic engines and things that we do to create pollution in our environment, and how those disparities can actually ruin lives. And so the work that we do with VCAN is just trying to bring light to those situations, because unfortunately my story is not unique in the Mon Valley. We have higher rates of asthma, higher rates of cancer, higher rates of dementia, higher rates of mental health. And so we're really just trying to galvanize the community to make a difference, just like most of the folks on this call.
Thanks, Qiyam. I'm so glad that you were able to survive that. It's just like scary as a parent. And I keep thinking about Terry's generational work because I have kids now, and like they're more aware of when it's a bad air day, so they'll just ask, which is just like a bad thing that kids have to ask, like, is this a good day to play outside, and but we want to bring in, if you're supposed to stay inside, Kevin, I'm going to go to you about what are the issues then if you stay inside that you're dealing with related to housing and health.
Yeah, thank you. I thought I'd talk about a couple of the pressing issues that we are working with low-income residents and communities, impacting their health and housing, and then maybe do a little look forward and circle back to the health department. One of the biggest paradigms in our housing market is that we have a lot of old housing stock, and a lot of our old housing stock has a lot of maintenance needs, improvements and maintenance needs, and it just has developed over time. You can look, with mapping tools to consider, exposures in communities, and you can see, in color and, real stark contrast, exposures within certain communities versus others. One helpful mapping tool is the Environmental Justice Communities mapping tool that the EPA and DEP use, and we were looking at this just recently. And they collect information on about 30 different, pollutants and, things that impact health, in the home, and in communities. And then they sort of cross-reference those with susceptibilities of the folks who live in those communities, like higher rates of asthma or heart disease or, higher mortality rates. And that's how they kind of project these pictures of environmental justice communities. And like just in Pittsburgh, for instance, looking along Penn Avenue, like every neighborhood south of Penn Avenue is generally not considered to be an environmental justice neighborhood because the indicators are low, and the cross-reference between high susceptibility and high levels of pollutants are low. North of Penn Avenue, it's a whole different story. It's like the highest concentration of, the cross-reference between high susceptibility and high exposures. And you have to ask yourself, so why is that? What is happening? And part of it is in a lot of our communities, that, are lower income and have been disinvested, naturally or systemically over time. Those are the neighborhoods where you have higher concentrations of maintenance and capital needs in the housing stock, And so one of the particular exposures we've been working with families in for the past 5 or 6 years with, a special focus is lead exposure and lead poisoning. And lead in water is an issue, but lead in paint is the biggest by far issue. The health department has participated over the years in the Lead Safe Allegheny Coalition that, we and many other organizations have helped to convene over the past years. We can look at that data. I mean, just last year alone, there were 4,200 children just within the city of Pittsburgh whose blood lead level exceeded the CDC reference level. 4,200 children just in 2023. So this is, an ongoing, real life, daily problem where we have old housing with old painted surfaces, deteriorated paint surfaces, especially these friction surfaces like windows and door jambs and things. And we need to, really proactively get ahead of that. The other pressing housing issue is just habitability and conditions. We see it, single family, we see it multifamily, we see it in major large complexes. Sometimes this leads to real conditions crises, sort of like what we're, experiencing at Montview Heights right now with this owner who is not, putting money into the development, and that sometimes puts us in these really stressful situations where mass displacement is a threat, and there is a lot to be said about that. But all of this, I think, points to a need, on our part to, utilize the resources that we have locally to be much more proactive in the way that we deal with housing conditions, the conditions in our old housing stock. And Iulia, very, very glad that you're here, to join us. You probably know, you must know, the housing division, the Housing and Community Environment Program within the Health Department recently went through revisions, to Article 6, to the code provision that they implement. And there was a ton of community input, with recommendations on how to, improve, modernize Article 6. And a lot of that went to shifting from a complaint-driven system to a more proactive system. And we've been having sort of ongoing conversations with health department staff and with Allegheny County Executive Inamarato. I will just say, I think in Allegheny County, we're super lucky to have a health department like we do with resources, because many counties don't. And as I said to County Executive Inamarato, both before and after she was elected, I think this is an area, like the housing program within the health department, is an area where you can get so much bang for the buck. And I told her, if I were you, I would triple the budget for what they are doing and really expand that program, to try to give a pathway for assistance to residents, particularly renters who are in this real susceptible position of not really being in control of the housing environment, that they live in, because they really, really, really do need help and a pathway to help to address some of these environmental conditions that they're living in. So
Thanks, Kevin.
probably exceeded my time.
That's great.
Thank you.
No, you're good. And no, it was good because you're right on the edge of I don't want to go to solutions yet because I want to hear from Dr. Vann about what you're hearing so far. And I mean, you've heard a ton the last couple months, but anything that speaks to you or,
Yeah, no, thank you for that. And I will definitely just go back to Kevin's points right now. I think that, the aging infrastructure and addressing the lead issue in Allegheny County is definitely a critical area that we need to address. And our housing team and the modification of Article 6 and our ability to move out a little bit more from complaint to proactive area, they're all so critical and so important. However, our budget is very small in order for us to be able to do that job. I know that a lot of people are talking right now about the county's budget and the different areas that the county is supporting. Our health department budget is really 1.6% of the county budget, yet we're one of the most out there, department with so many different forward-facing and direct services to our community members. So it is really, really critical that we continue to uplift the importance of the health department being fully funded in environmental health program, the air quality program, the housing program. We want to do all of this work. We have the passion to do this work. We have the team expertise and knowledge to do this work. But if we do not have the budget to support it, then we will not be able to continue to perform these critical services to the community. So thank you, Kevin, for bringing this up. I think it's so important. So that's one thing that I'm hearing. I'm also hearing a lot of focus and just kind of laser focus on air quality and environmental health. Definitely moving from Guilford County to Allegheny County, it brings a unique perspective. There are some unique challenges, but there's some really exciting opportunities. So the top of that list, I would just say that Allegheny County, with its industrial history, it faces significant air quality issues, especially in the Mon Valley area. And we've heard that from some of the other panelists that are here with us today. Compared to Guilford County, where we didn't really have that type of challenge, we were more focused on water quality because of forever chemicals that existed in the textile industry in that area. This is a more urgent need here in Allegheny County, and we really need to be able to address those long-standing disparities in pollution and air quality that are impacting respiratory health. And we heard Mr. Ansari talk about this affecting him personally. And all of people in your family that, people in your friends, your networks, clients that you're working with that have experienced these negative health outcomes because of poor air quality, which then in turn exacerbates health disparities. So, but the opportunity I believe here is that we have a very, and I'm really learning this fast, that we have a very robust network of community organizations, advocates that are already focused on environmental health. They're coming to the table. They want to have these conversations. They're just so passionate for the work that they're doing. And this collaboration presents such a powerful tool and such a powerful opportunity for us to leverage these resources and come together as friends, as partners, as advocates, as parents, as friends, as daughters and fathers, to really address this issue. So that's definitely something that I'm hearing. And then also mistrust. I'm hearing that. I've heard Terri mentioning and Tracey also bringing this up through the work that they're doing at JADA House International, at Project Resiliency. I think that it's important to identify that, not identified, it's been identified.
To say it, to keep
but we
saying
need to say it, and we need to start internalizing that and really applying that, or thinking about that and thinking through that lens every time we are out there in the community doing big or small activities and interventions. I think that from my perspective, having that type of approach throughout the entire organizational structure of the health department is really important, because I don't think that it's important that just my boots on the ground team members are, seeing this and identifying it, and looking at it through a mistrust lens or trust, shaky trust lens or health inequity lens. But then we're doing that throughout the entire layers of the organization, all the way, to our leadership team. I have a leadership style in which I don't believe in that very, vertical type of, approach. I also believe in the horizontal one. So I'm hearing this from the conversations that I've been having, but then also the conversation that we're hearing today on the panel.
Thank you. And I think even by being here, like you set a tone, even, while this might be a handful of people, like by you being willing to show up, to listen, to be physically present, that's not something that is always the case. So I think it's a huge step forward. And so I want to go to questions in about 5 minutes, but I want to ask anybody from the panel if you guys have ideas on how the health department can work better with communities, or how, residents' communities can be more plugged in and work more proactively, because we don't want to just keep talking about the problem. So I'm sure you guys have some ideas on that front.
I have a question, really, and it's sort of an idea to speak to something that Dr. Vann stated, which is a current constraint of ours. And so, we've been trying to raise money to address these challenges, and we understand that, the number one, the health department's not funded the way it should be. Number two, the air quality program's not funded the way it should be. So we've been trying to advocate on the outside to, show that there's people that would support an increase in the funding that's being able to be received. And I think that's a great strategy, but that only works so well. And so my question is there an opportunity, as nonprofit organizations, as all this federal money is percolating in the ethers, to work with the county to try to directly fund some of these programs and these shortcomings in our budget if we can't get it from a county negotiating side? I understand our county executive will probably have to make that decision, decide to funnel some money. But if we can't do that, I think we could all, as people that are talking with the community, think of and put in the sweat equity to kind of try to bring some funding in. But I'm wondering, what is that pathway to make that happen, or is that a possibility?
Yeah, I can jump in here just real quick. I know that we have a variety of different opportunities in funding. Just in general, public health funding is probably one of the most diverse funding streams that you will ever see. You'll see local funding, state funding, federal funding, philanthropies, foundations, local donors, individual donors, grant applications, and so on and so forth. So I think that overall in public health, we're just so used to making sure that our portfolio is so diverse from a funding perspective, just because we always need additional funds to support it. There was a it was a recent endeavor that took place in another state, and I don't want to quote it incorrectly, and I don't believe that it was Ohio, but there was just this massive public health campaign to show the fact that the dollars that are invested in public health are just so critical in making sure that the health outcomes of the community are moving in the right direction, that there's so much saving on the back end from the acute issues that are addressed in the hospitals, from the productivity lost in the community. And that state has made a decision to invest. I think it was like $114 per community member in their local public health system. That is not something that I know that we're going to be able to achieve tomorrow, but this is the type of work that we need to do together. Yes, having the foundations and the philanthropies at the table, it is super important, and we always lean on them to help us with the work that we're doing. But in order for our work to be powerful and impactful, we need to have consistent, recurrent, flexible funding that we can really depend on. And we need to be able to tell the county, the municipalities, the townships, the community members, this is what your taxes are buying. These are the services that we're able to provide to you because you're investing in this type of work. So I think it's a plethora of ways, Qiyam, that we can work on together. I have a lot of thoughts about that. I come from a health department that was very well funded. So think about the fact that my jurisdiction previously was half of the population of Allegheny County. However, my budget was $10 million more than the budget that we have now here in Allegheny. So I joined the team with also the purpose and the goal to make sure that we're expanding the funding for the health department.
Okay, thank you. And I want to, hold on, Kevin, I want to give Tracey and Terri a chance of other ways to work better with the health department. We know money is an issue, and we could probably go on and on and on about that, but Tracey and Terri, any other thoughts on just like collaborating and communication?
No, I think Ms. Vann was on point with that one. Like
Okay.
so on point, so targeted, because if they understand what they're funding and the work that we're doing, it would be more feasible, and also for us to come together. It's all about collaboration and unity as when it comes to community services. But if the funders would understand and know that the essence of the importance of health, wellness is in communities, I think that will make a difference, but we have to come together as a unit.
Thank you, Dr. Vann. Just your outreach to all the community leaders and organizations, that's so welcomed, because that shows us that you're going to be on our side in these important moments when we're doing this work. I know that you talked about the funding and things of that nature. Is there any chance that this panel is great, but is there any chance that we can have a meeting once, like every month, or just to come together on ideas and explore other opportunities that might be out there, even for funding, but just for growth and expanding and just being able to have these conversations once a month? I know during COVID, we had the the Vaccine Collaborative, where we had a group of people that met
I
every.
believe they're still meeting, they're still doing work, very good work, yes.
Yeah, I'm actually on that, but they changed the name from vaccine. So yeah, Dr. Liz is still.
Immunizations Collaborative, I believe.
Exactly. You see, you know, you done your homework. We appreciate that, because that means that you're invested here, and that's welcomed. Thank you.
I would love to explore that possibility, Tracy. I'm already having some conversation with additional friends and partners to think about some type of just recurrent touch point for us to brainstorm ideas and come together. I don't know exactly how that's going to look like, but just stay tuned, because we're definitely on the same wavelength with that. So yes, thank you for that suggestion.
Okay, so I want to go to Kevin, and then Bianca had her hand up.
Yeah, I'll be brief. A couple of quick things. One is, when Article 6 did get revised recently, there was a new provision added to create a housing advisory committee to work, with the Housing and Community Environment Program. The county executive will be appointing folks, to participate in that committee. Everyone here can throw their hat in the ring on the Allegheny County Executive's website to apply. You have to submit like a resume. There's an electronic form you'd have to fill out, but I just want to flag that for people, because that's a good structured mechanism for community engagement. The other thing about community engagement, there are just so many tables of advocates and stakeholders who convene, like the Let's Save Allegheny Coalition, EJGP, but there's like big coalitions and then little coalitions that touch on housing and health. And I think the health department ought to really like plug in and understand that environment, and really like send someone to all of those tables to really participate, because it's a great way to plug in with people to generate ideas. The last thing about financing, one example, not to say this is the only example, but Cleveland did a wonderful job generating funding when they were creating their lead safety, lead exposure program. And fundraising was a huge part of it. They generated $150 million. And the largest chunks came from the hospital and other philanthropy in town there. There's a consultant from Cleveland who is working, with the Get the Lead Out group, which is being convened principally by Women for a Healthy Environment. We're going to have the utility of that person, with us for some months to come. And we really should, bring some stakeholders, city, county, philanthropy, and others. If we could get a couple of the hospitals and a couple of the big historic polluters, like US Steel, the paint companies, there's potential to get big chunks of funding in a similar way as Cleveland did to direct toward lead safety, but it could be just more habitability,
That we can't hear you for some reason. No, still
Me?
can't hear you.
Me?
Go ahead.
Can you hear me now?
Yes,
Okay.
can hear you now. Okay.
Yeah,
So-
Bianca
Hold on.
and then Carol.
Okay.
So, I was wondering, so I know that a lot of the talk has been about local Department of Health and Human Services funding, but what if go after federal Department of Health and Human Services funding for more permanent funding, instead of it being grants, grants run out, et cetera, it'd be more permanent funding by going to the Department of Health and Human Services for more permanent funding. Is that a possibility at all?
Yes, Bianca, thank you for that suggestion. I think that going to HHS and the federal funding, NIH, CDC, all of the, like federal agencies, that is definitely an option, but that is not permanent funding. All of the funding that comes through these agencies are typically 99.9% of the time offered as grants, and they have a limited time. They're very much competitive grant applications. You have to be very specific with.
Oh,
the
I should have
that
said more
you're going
long-term
to
funding.
do.
I'm sorry.
Yeah,
I was using the wrong term. Sorry. I had an hour and a half of sleep today, and
Oh,
I've been up
no, I'm
since
sorry to hear that.
5:30. Yeah, more long-term funding. Sorry. I don't. I understand. I was just trying to think of ways to get. I know that they're competitive. I know that. I know that they tend to be a lot more because I've written for them before. My mom has written for them before. They tend to be a lot more over a longer period of time. So funding isn't something you have to worry about for a longer period of time. And you can plan out writing for the next one or the next several over a longer period of time for your next round of funding. So it just eases the funding part a little bit, in between. And I from what I've seen on that level, it produces a lot better results because funding is one of the things you're not worrying about, So that was just a suggestion.
No,
Thank you.
thank you. 50% of
welcome.
our budget is coming through federal or state funding.
Okay, Miss Carol, I want to go to you next.
Sure. Sorry I'm late.
No, you're
But when
welcome.
I heard, I just wanted to really say, in regards to funding, in regards to everything, and in regards to getting outcomes, none of this is going to go away unless we really call it out, which is racism. And if we don't put a racist lens of justice on anything that we do to move forward, whether it's health, whether it's education, whether it's housing, it's just going around the same mountain. Reason why I say that, because this has been going on since what? We were told we were free from being slaves, and then we wanted to go somewhere and be free, and it just never has happened. And then we were, pushed and contained in the worst communities, the worst conditions, the worst of everything. Yeah. So I'm just so tired of people telling me, oh, Black people got the highest sugar. Black people got diabetes. What? Well, whose fault? And I can only talk about the trauma that this does, because you need a trauma lens as well, because this has not been easy. And I respect everyone as colleagues, but I'm like, we really have to do this work realistically in the right way if we ever want to, get some outcomes, because I hope the foundations ain't on here, because they are the ones that cause.
They are, don't worry.
And then they just want somewhere where they could wash their money. And, for real, I'll be like, yeah. So I think we do need to, like, when we are getting on money and looking for funding, if there's not a racial justice lens to anything that we do and call it out, it's just never going to end.
Thank you.
So I had to say what I had to say.
No, I appreciate you naming it. So that's why you're here, And Iulia, I don't know anything about Greensboro, and so I don't totally know the racial makeup of that, but
Greensboro served as one of the pillars in the civil rights movement, and we've celebrated that type of approach to the work that we were doing in the health department. Greensboro is a majority Black African American community. The county is not. So it's a very similar dynamic to what we're seeing with certain communities in Pittsburgh, and then the county, as a whole. So a very similar dynamic that we had with maybe like just a slightly different history to Greensboro. The sit-in movement pretty much started in Greensboro.
Okay. I want to give her one more question if you have a minute. So Dr. Vann does have to leave us at 3, but the rest of us are staying on. Does somebody have one more question before we let her run and then we transition? No question.
I got to go and talk about a budget in a budget meeting. So.
Oh boy.
One last thing that came up in the chat was just a question about requiring large institutional nonprofits and polluters to pay to support this work. And so I think maybe as a transition, if you could just say a word about maybe how you're approaching thinking about large institutions, especially the health systems and other polluters.
Yeah, so that is, I don't know exactly what the question is that came through the chat. I know that as my role as health director, I believe that I need to really build really good relationships with our healthcare systems. They operate in a certain space of healthcare on the spectrum of services that we're providing. Public health is providing a different type of services, but altogether we're all really still serving the communities, just in slightly different approaches. The polluters are a completely different, relationship and a completely different approach. We are the regulators of these institutions and these organizations. So, from my opinion, as long as, we have very strong regulations, we have strong rules in the county, that is the bottom line. Everybody has to follow those rules, and if you don't, we're going to take the actions that we need to take in order for you to come back into compliance. So yeah, slightly different relationships between the healthcare systems and the polluters. So I put my email in the chat. It's yulia.van@alleghenycounty.us. Email is the best way to contact me. If you want to reach out to me, if you want to have a conversation with me about a particular area or about all areas in public health, if you want us to find ways to work together, to brainstorm ideas together, I am welcoming the conversations anytime, any day. So I'm really looking forward to connecting with some of you, all of you, moving forward as I'm getting to know our community and our partners better. Again, thank you so much for having me today. I really appreciate it. Again, I'm really looking forward to working with each one of you. And I'm sorry that I have to jump off. I hope that you will continue to have a great conversation for the rest of the time that you have together. And thank you for my panelists for allowing to be part of the conversation today.
Thank you. You were a great gift to us today. Thank you.
Thank you so much.
Thank you.
We'll see you soon.
Thank you, Dr. Vann.
Okay, so yes, I know it's not ideal that she had to jump early, but we just are glad that she was able to make this time, and we were able to make this work. So Jason, do you want to go into breakouts or take some questions here before we do that?
If we could take one more question while I set this up, that would be great. Maybe we could follow up with the question we just had, but go ahead.
Oh, sorry.
Jacob, did y'all do the Heinz piece yet?
No, no,
Okay.
not today. I think. Okay, I'm just looking through all my little boxes. Does anybody have any additional questions or sort of food for thought for the panelists on the various things we're talking about?
Don't forget the equity lands. I'm serious.
I know, I wonder how I know we didn't have much time for that, but I wanted to ask you how they deal with that at the department. Are they intentionally?
You got to kind of look at where the harms, you got to do your homework of the harms and weigh that in. So, but you have to kind of suggest it, because I doubt if they even think of it in that way.
And that would be a good topic for discussion for a housing advisor.
Yeah.
Around everything, Kevin, everything that has affected Black people.
Well, that's the thing. If you look at CMU and Pitt, you're looking at $8 billion worth of endowments that basically take up a whole neighborhood in the city of Pittsburgh and raise the rents in every neighborhood that surrounds those neighborhoods. So it's not just the institutions aren't chipping in; the institutions are actually exacerbating what the issue is. And they get to use the amenities of our city without actually having any sort of promise of what they're going to give back, and what they do give back is usually something that helps their institution more so than the city itself. Especially like you said, when we look at race, the sure as heck ain't necessarily looking at,
And that's what I mean, Josh, the ones that they continue to just make all these problems, and then, they use their money to wash their money around the things that we know that we need some help with, right? And I mean, it's just a lot. And it started from the institutions and, those that were slave owners and so on and so on. So, it's just been passed down. And here we are, 2024, still going through it.
And I'm guessing it's going to take her a little bit of time to get the lay of the land with the those big institutions here in Pittsburgh and the dynamics between all that,
Well, if you don't speak up to them, they won't. Well, they'll never admit it or call it to their attention. That's why I say I hope the foundations ain't on here. But then sometimes I don't care if they are on there, because I let them know that too. We're doing the work that y'all, the government and they're the ones cost, and then y'all want to feed us crumbs. So it's just
we're gonna all be here talking together. So
yeah.
Jason's got these rooms set up, so he's going to transition us into 4 smaller conversations with a panelist in every room. There's 4 of you, right? Yeah, 1, 2.
Yes. So everybody, thank you all for this conversation so far. And I just really thank you for being a part of it. And I just want to draw attention to the fact that, we, or at least for me, Dr. Vann speaks in a very different way than previous health directors have about these issues, and especially about the role of community members and residents in this process. And so, we can say that, we advocated for this, right? This was in the letter that we put together as EJGP last year, in calling for a health director who was attentive to public health, who really prioritized community relationships, who really cared about inequity and injustice and how that showed up in health outcomes. And so, I think it shows on it speaks to the power of this group and all of you. And when we come together and we're able to work together to advocate for the people that we want to see in the positions that will affect people across the county. So with that in mind, I'm going to open up the breakout rooms, 4 different rooms. One of our panelists is in each of the rooms. If anybody is in your room is willing to take notes, please use that note sheet that we just put in there. You should all have it, should all be able to access it. But yeah, it's just really an open conversation reflecting on what you heard today. So we encourage you to share your thoughts. And if you have any questions, just let me know. We'll be here for about 10 to 15 minutes in these breakout rooms. Okay. All right. I will open them up. And if you need help moving to a breakout room, let me know. Everybody's back now. Welcome back, everyone. Welcome back. Thank you all for joining those breakout sessions and chatting. I'm curious to hear really briefly if there was anything that came out of your conversations that you think would be really important to share out with everybody else. Go ahead, Qiyam. Yeah.
I appreciate that. So I was in breakout group number 1. It was myself, Linda, Holly, Phoebe, and Sharon. And we had a great discussion on 2 of the prompts that you asked, a high-level rundown of what we think is, the most important thing to share out. So just really 2 things. The first, we think that this space is a great space to serve as a vehicle to make sure we have longer term planning with the health department. We think there is a real opportunity with meetings like this where we can facilitate and hold conversations that will allow us to pull together these larger goals that we have. One of the things that we identified in our breakout group is that in order to be effective, we have to break outside of our individual silos. So air quality is not the only concern of the health department, and we need to make sure that our priorities and concerns touch the other departments that the health department prioritizes, and we have a full-fledged vision for how we can all work together to make sure we're addressing that gap in services. And in order for that to happen, like obviously you need to have a plan. So given that they need funding, number one, we could pay for the time to join these calls, and we could pay for a planning process to create, an agenda to sort of go out, raise more money, and address some of these long-term concerns. We also talked about, the fact that although this is a great space to meet with the community and have these discussions, we also need to take a two-tiered approach and be physically in the environmental justice communities where people are living close to these industries of destruction, for a lack of better terms, and really bring them the resources and bring them into the conversations, but we need to meet them where they're at on the ground. And we thought overall, we're very happy that Dr. Vann, there's a willingness to meet with us, to communicate, but we think it's on us to kind of follow up to make sure that we are asking and advocating for that space to continue to be held. And we think that this is a great tool to do that moving forward. Thank you.
Great. Thank you, Qiyam. Thank you for everybody who was in that group for those things. I think that was a great summary. I don't know if any of you have anything else to add to that, but I think that's a lot of fodder for how we can think about how we can move this work forward. And is there anything that anybody else wants to add smaller, because it is getting close to 3:30?
A quick one from our group. Really forgetting the name, but one good suggestion she had was for the health department to have more information, a social media manager, and more information on social media, because the population is not learning about some programs because they're online a lot and not using of information.
Good. Go ahead, Terry. Yeah.
Also, it would be nice to have Mr. Mosey brought up the churches and the universities and those types of people that need to be on this call, so that we can still continue to come together and try to make a difference, right? Because I heard what Ms. Curl said, and it's the truth, nothing but the truth, but we have to come together and make things happen. It would be nice if Yvette and Jason, if you could maybe, I don't know how this works, but if you can get those people on the calls, and if we could have maybe monthly, I don't want to say week because we got enough Zoom meetings we do every day, but maybe quarterly meetings or something, just to bring these people together and bring more resources together, because that's what it's all about, coming together. It may not make a change, but we'll see.
It already is, just even having this group of people together is different from the way things usually operate. So
I wanted to share that another important thing my group discussed was how to get the brown and black community together and work on these issues that are affecting both of us. Like I was sharing, I feel like some powers are trying to pit us against each other, and we need to be united in this. So we were thinking about with Mr. Andrew and Terri and in my group of having a meeting where we can really bridge between the organizations that are working here, the Latino organizations, and with the Black communities organizations, so we can really start working together.
Thank you, Christina. And Christina's from Latino Community Center too, and they have a bunch of community health workers as well. So it'd be interesting to think about how community health workers there are hearing and what they're hearing, and if that's different from what your community health deputies are hearing, Tracy, over at Neighborhood Resilience Project too. Yeah, Ms. Carroll, go ahead.
Yeah, I also think that we need to work on the equity plan and really just start working on it, you know, because it needs to be done. Because the ones that caused the harm, they're not really stepping up to the plate to rectify it, right? And then, you know, it has to be done and connected to all the work. It can't just be about the environment. It has to be connected to housing, food, all the disparities around the table. So, you know, we have to start working on that because and really not just calling it out, but I sit down and say what we want and how we want it and this and that, because UPMC or whoever, Carnegie Mellon, whoever, they'll never admit it. And then sometimes they don't even realize that that has happened, right? Until you call them, you know, call their attention to it. And they're like, oh, well, I'm so sorry. Even around the housing, like, you know, yesterday we had the Choice Neighborhood groundbreaking, and I was so happy about that because, you know, they did follow the Build First and Don't Displace that we really advocated for, but residents really stepped in and told them how they wanted it and what they wanted for their kids and their families. And, you know, they wanted it to be around the Celine's Market. They wanted the new, because other than that, they could have put that, those units way out in Never Land, you know, and displaced all those people from Chauncey and their family and their. So I think we just need to really step it up. We could do that and just say, hey, if you're going to do healthcare, we need this, that, even for our kids in school. If you're going to do housing, we need this, that. Not so much of the units and the closet space and all like that, but really and truly to make it accessible to transportation and all the other things. Then you'll have to keep turning back and forth, going back and say, oh, well, there's housing, but, you know, there's no food stores, there's no transportation, there's no, like, and it's by where they got all this pollution across the Birmingham Bridge, you know, so.
Thank you, Ms. Carroll. And before we wrap up, I thank you everybody for that. Before we wrap up, I do just want to say thank you and let everybody know that there have been several people from our advocacy and organizing training on this call today, several of our participants from year 2. So I see several of them now, Ms. Sharon, Stephanie, who else is here? Andrea, Sharon, Bianca, and Jose was on earlier. Yeah, all of those are participants in our current training program. And so, you know, part of that is about getting more residents across the county connected to all of you and really building the strength of all the work that we're doing by connecting. And so thank you all for being here today. Thank you, all of our participants.
You're welcome.
For being here. And as Yvette put in the chat, we will be sharing out a video of this that you are free to share too. All right.
Thank you guys. See you guys. Be safe.
Thank you to our panelists.
Everyone
too.
have a
Thank you
great
so much.
day.
Yeah.
Have a great rest of the day.
Thanks.